Nice to meet you.
Nice to meet you too.
Um, Tell me about yourself.
Okay, I live in Houston, Texas. What I do for just a primary job is I'm a case management for a nonprofit now.
Oh,
Um,
right on.
but I also do competitive dancing, break dancing. So yeah, so I've been doing that for a while. Uh, that's pretty much I do. I just live alone. I mean, that's pretty much just my life like that. I don't work with kids from age groups from sixth to eighth grade, middle school. Yeah, and so I'm doing activities with them. You know what I mean? About 2 hours a day, 2 3 hours a day.
Oh my God, bless you, my son. That is a rough age group,
I think it's the
especially.
best age group, actually.
Oh, do you really?
Yeah, yeah, yeah. I feel like they're still a kid and they're still finding themselves. They're still in the middle.
You can have all of them. I will give them all to you
Yeah.
if I could. Well, okay, tell me. So, did you say you do competitive break dancing?
It was during I was doing a back bench a squat, a back squat, and that's when
Oh,
I felt, oh man, that felt weird. Yeah,
so you
yeah,
were doing a weighted squat
a
with the
weighted
weight
squat.
on your back. You went
Yeah,
down, you felt, did you hear a pop or no?
felt something go like this, on my back,
Yeah,
and
squish.
then
When was that? Put a date on
it
that for
was.
me.
It's actually how the exact date. It's been 11 weeks. This Sunday is gonna be 11 weeks.
All right, 11
Yeah,
weeks ago when this happened.
yeah,
I want
yeah.
to drill
January.
down on that pain because the way it hurts could be a big clue to me as to what is hurting. And what we're trying to distinguish between is the pain that comes from a torn disc, which often happens during squatting or deadlifting, or the pain that comes from a sore joint. And so, if it's okay with you, I'm going to ask you a series of really specific questions. There's no right, there's no wrong. And if you don't know, it's fine. But just tell me if you can answer these questions. Is that okay?
Okay,
All right. Is your back pain more in the middle or is it off to one side?
off to one side,
Is it off to the right side or the left side?
left side.
The left side. Okay, interesting. And does your back pain sometimes feel like it's in your hip?
And mm, no, not so much. More in in the front area of the hip, I guess. Yeah. Yes. Yes.
The front meaning into the groin area.
Yeah, into the growing area. Yeah.
Okay. Does your back pain ever go into your butt?
Yeah, it does.
Where does it go more, your butt or your groin?
Uh, I think it depends when I'm like straight up. Like I guess when I'm like walking, growing. When I'm sitting down, is like my butt. Yeah.
Do you have pain when you're getting out of the car?
Yes.
Yeah.
Yes.
Do you ever notice like you're fine and then all of a sudden you get an agonizing pain and boom, it's like gonna drop you almost.
Yeah. I get those, especially the first 6 weeks. I had those.
Yeah. Yeah. Okay. Have you ever had any problems with your hip, with your left hip?
Nope. I'm used to like healing, so I like the first. I was like first. I just let it wait. I went immediately go get an X-ray because I don't
Yeah.
want nothing to be broken. And
Yeah.
then I went to go get an X-ray. Nothing was broken. And then they were like, "Oh, okay, you should be fine." And then just come back if you feel like you're having any issues. Nothing was broken, and I didn't think much of it. And so like 4 weeks passed, 5 weeks, 6 weeks. I'm like, man, this thing still hurts. I'm like, what the heck? And then I tried to do a little bit of exercise, and then the next day it hurt so much, and then I was just like, no, something's really wrong. And so then that's when I went to go get the MRI, just the back, and then it started leaning more towards the left side. I went to get the MRI, and then they just like what you're gonna read on there. That's what they tell me that.
Yeah. Yeah. Can
Um,
you do me a favor? Stand up and turn around and show me where it hurts. Right there. When you push on that right now, is that where it hurts or that's what hurts?
that's where it hurts.
Is it deeper?
Yeah, like deeper inside. Yeah.
Okay. Okay. I got you. Jose Cardenas, my man, let's look at your MRI, okay? All right, so what the heck is going on here with poor Jose? He's 30 years old, doing the right thing, working out, getting ready for breakdancing, and all of a sudden he's got this complex and horrific back pain and back problem. Back pain seems like it's infinite. It seems like there's a million different versions of it, but there's actually only 4 distinct causes. And it's literally crucial. In fact, it's prerequisite that you start by breaking down your back pain and figuring out which one of these 4 groups you're in. You got to start with understanding what's wrong. You got to start with understanding what's wrong. So let's break it down. If you've had back pain, then try to put yourself in one of these 4 groups, A, B, C, or D. If you've never had back pain, then as an exercise, try it for Jose. The first type of pain is from a herniated disc, and this one is mostly in the leg, feels like electricity or lightning, and is associated with numbness or weakness. None of this stuff's been mentioned by Jose, right? His pain is mostly in the back, off to the side, sometimes goes into the groin. Second type is from an arthritic facet joint. This is arthritis of the spine. That's an ache on one side of the back. Oh, well, that's him on the left. Feels like it's coming from your hip. That's not really him. This hip pain is off to the side, not into the groin. It spreads to your butt and tingles over the outer thigh. You heard me ask him about that, and that really wasn't it. So it doesn't sound much like facet arthritis. The third type is due to a tear in the disc. Remember, discs have 2 parts. This hard outer part called the annulus, soft inner stuff called the nucleus. If you get a tear in the annulus and pain fibers grow in there, discs normally don't feel any pain, but if they're torn and they start to heal, that healing has granulation tissue, and that granulation tissue has pain fibers, and that's a definite source of pain. Some people call this internal disc disruption or discogenic pain. It's the type of pain that comes with degenerative disc disease. This type of pain is in the middle of the back or wherever the tear is. The tear is usually in the middle, but if the tear is off to one side, then the pain can be off to one side. It feels like a knife in your back. So when you touch your back, you're not touching what hurts. It's deep in there. You can get over it, but not touch it. It's worse when seated. And I would add to this chart, paradoxically, whereas most back pain, 95+%, gets better over time, because the pain of an annular tear is due to that granulation fiber, this kind of pain actually gets worse over time. It gets worse as the weeks go by. The last one is from stenosis, and that's mostly in your legs. Feels like electricity or heaviness. It's relieved by bending or leaning over a shopping cart, and none of that is this guy, right? None of that is this guy. All right, so which one is it? A, B, C, or D? Let's go on and find out the answer to what's causing his pain for sure by looking at what's on this test, what's on the study. But first, let's take a dance break. Okay, this is a cut that goes right down the middle of you, and these bright white lines are your discs. The kind of pain you're describing is typical of a tear in a disc. And I want to look on your left side because, yeah, there it is right there. So this is a normal disc. This disc, see how it's lost height? And then if you look right there, there's a high intensity zone in the disc right there. This is the disc, and then it's dark, and then there's a spot. That spot, see this? There's no spot like that. It tapers down, tapers down, tapers down. There's actually a little dark area here, but not much. But this little tear is probably that little spot right there is probably a little fissure tear that happened to your disc when you were squatting. That's called an annular tear. And they're very common. It feels like a knife in the back. Yours is off to the side. They're often in the middle, but yours is off to the side, so it feels like it's off to the side a little bit. They usually heal up on their own, but my goodness, it takes forever. 11 weeks is not a long time for a disc to heal. All right, so we're there. Jose has internal disc disruption, also known as annular tear, also known as degenerative disc disease. It goes by a lot of names, and it's a lot of things to different people. But the one thing they all have in common is back pain, miserable, stinking back pain. Well, let's talk about treatment. There are pluses and minuses to all these treatments. You'll see Jose and I go through it together. The short list of things that really can be done starts with a back brace, nonsteroidal anti-inflammatory drugs, and core strengthening. Those are the things you try for the first 12 and maybe as much as 24 weeks if you're getting better. Some people then recommend intradiscal growth factor injection. We'll talk about that today. There's also a new option, radiofrequency ablation. There's a new FDA approved procedure, which is young, but seems to have some promising results. And finally, there's the neutron bomb of treating this, and that's discectomy infusion with interbody grafting. Let's unpack these with Jose. But first, dance break. You got to get strong again, but not aggravate your back. And often that means elliptical bike, non-impact exercise, or yoga, or Tai Chi, or martial arts, things that get you strong in your core, but don't aggravate your back. And it's a lot easier to say than to do, which you've already discovered when you try to exercise and the thing boomeranged on you. So, but you got to wait this thing out. There's no good intervention treatment. Epidural injection is not likely to help. And I would strongly recommend against any kind of surgery or basically anything other than supplementing your diet a little bit, making sure you're on a good diet, and getting that core strong.
Stem cell stuff in Mexico and these other countries that they're able to do the other stuff.
So I can't really recommend it to you because there's no evidence, but it makes a ton of sense to get growth factors, stem cell derived, amniotic derived growth factors injected into the disc. Here are the positives of that. The problem is there's a tear in the disc and discs don't heal very well. The idea of growth factors is that they organize inflammation and make it stop hurting and start healing. And so it makes perfect sense. In my own experience, I've only done that in a handful of cases, and it worked obscenely well. Like I was shocked at how well it worked. But the downside is there's no strong evidence. Injecting anything into a disc damages the disc. So you're creating further damage, which is never a good idea. Okay. There's no way to give you a number. There's no way to say, it should help. Does it? We don't really know. Could, should, probably, kind of, maybe, not good enough. So I would say if I were desperate, I would think about getting a growth factor injection into a disc. Another negative is not covered by insurance.
Yeah.
This is cash. It's going to be thousands of dollars. How old are you?
30.
30 is the cutoff for PRP. You could have PRP. They draw your blood and then filter it, spin it down, inject that back. You stop making growth factor as you get older. Over 30, like I'm almost 60. No, but you
look
maybe.
Great for 60. I thought you were gonna be nowhere near that.
I'm near that, bro. But anyway, and I'm feeling it. But but for you, so PRP, not a bad option instead of the amnion derived growth factors. Some people do both, but honestly, I would say that's a roll of the dice, and there's a definite certainty to there being damage to the disc. There used to be a test called discography where we would do the exact same thing, put a needle in a disc and inject it to visualize the tears. And one thing that came out of that was discography makes discs worse. So the growth factor injection, the injection part will have a negative effect on the disc. So, I mean, the way I would process that is to say, if I could get better on my own, that's number 1, 2, 3, 4, 5 options. And 12 weeks is not too long. I might mark my calendar. If I got to 24 weeks, I would do 2 things if I were you. First, I would get an MRI of my hip, because a lot of what you're feeling could also be a labral tear in the hip. The pain getting out of the car, the history of a pop while squatting, the pain going into the groin, that's labral tear kind of stuff.
Okay.
the back pain that's in that spot but deeper, that's a torn disc.
Okay.
And we have a rule as doctors called the parsimony of diagnosis. You only get one problem, but
Mhm,
life has a way of not respecting those rules. You can have
mhm.
both. And so, for all we know, you got two issues. I would mark my calendar for 12 weeks from now. And if I was
Okay.
still having issues, I would pursue the growth factor injection after getting an MRI of the hip.
Of the hip. Okay. Okay. Sounds good. And your videos help a lot. Watched a lot of them.
Oh man,
Please
thank you so much.
like or
So
subscribe.
thank you so much for joining. We're really I'm really here to serve, and I'm hoping it serves you.